Hi guys, this is Dr. Bhupesh from Dr. BKM OET Institutes. Please subscribe our channel if you have not for your own good. And our contact number is 76967 34256. For the people who are abroad, it's +91 that you have to put in front of 76967 34256. All right. So today I just have got this question that when I write visit letter, I make mistakes. See, I really believe when it comes to grammar, I hope you can all see that. Can you put in the chat box whether you can see this thing if I write anything over here? Can you see everybody? Just in the chat box. If one yes comes, that means yes. All right, cool. Thank you very much. That's it. I got it. Thank you very much. Thank you for your response. So see, grammar of OET, if I say, it's not grammar of OET. First, it is grammar of English. But when it comes to OET, we are talking about medical. Now there are you say, sir, I have a problem in visit letter, and that's where I committed grammar mistake. I will say if your grammar is good, it does not matter whether it is a visit letter or that letter or this letter. What will happen in a visit letter? Patient will come to you on 23rd, then patient will come to you maybe next month. So suppose if he came to you on 23rd May for the first time, M should be capital always. Small things, big marks. Then suppose if patient visited to you next time on 25th June. He did not come for 3 months. Then he came to you on 24th August. All right. So that's the scene. Suppose if there are multiple visits, you can take as many visits as you want. Now, when we are talking about grammar, so how can I write it? 23rd, 25th, and 20th. So I will say, just simply think on first visit. I hope you all can see it. Yes, okay, yeah. So on first visit, the patient presented or patient visited. See, this is an active voice. Active voice means that patient came by himself. The patient presented or the patient visited. That's simple. Whether the patient visited or presented, that is a second form. Second form, my dear, means that it is an active voice. That means patient came by himself. Patient came by himself. Patient, like if I went somewhere, I will say, I went to a party yesterday. Second form, I went in the same way on first visit. That means if today is 24th August, on 23rd May, on first visit, the patient visited himself. So there is no grammatical mistake that can happen. So patient visited with chief complaint of. So I write it this way. Now people will try to cram it. But if you want to write it any other way, you can simply say on first visit, I will copy paste. You can also write it this way now. Yeah, you can also write it this way. On first visit, the patient visited. On first visit, the patient visited. Now, what is not good over here is visit word is given. I'm again using the word visited. So it is not looking like. That's why I changed the word. On first visit, the patient presented with chief complaints. I can also say the patient presented and complained of. This is also correct. I don't have to make grammatical mistakes. That's the only thing in OET. So patient complained by himself. Nobody else complained on behalf of patient. Suppose if there was a child who is 3 year old. Now, now the same letter again I will copy paste and I will say on first visit the patient was presented. This is the only grammar that you need to know in OET. What does it mean? That patient was less than 3 years. Patient was less than 3 years. So that is why he was presented. Was plus third form means passive voice. That means he was presented by his mother. That is the only thing you need to learn. On first visit, the patient presented was presented. Because he was 3 year old, he cannot come by himself. That is the only grammar in OET. Please think about it. If patient is presenting by himself, second form. If he is a small child, then his mother would have brought him. So on first visit, the patient was presented or the baby because he's a small baby. So the baby was presented. That is the only grammar. Now let me make it little more for you. I'm just going to take an extra page. I hope it is clear to you all. I'm using some extra font size. I will make it smaller, the font size, so that you can see it more. Okay. Now, if I am talking about the patient presented with, so he came by himself and complete. The patient presented and complained of XYZ, A, B, and C. Suppose these were the symptoms. Suppose he had more symptoms. I will say along with that, full stop, along with that, comma, he was also having D, E, and F, rest of the symptoms. So these things belong to the patient. So he was also having present continuous. The patient presented. If you want to put second form, then also you can put he also had. That is also equally good. Just do not make the passive voice. What is passive voice? Was plus third form. Do not make it when patient is doing everything by himself. So you say the patient presented and complained of A, B, and C. This should have been comma. Along with that, he also had D, E, and F. Now, on examination, that is where the grammar changes. Whether it is a visit letter or it is during hospitalization, it does not make on examination. Now our work has started. Our work means now the hospital work has started because examination is done by us. So that is where grammar changes. On examination, he was found with. Now this is our grammar because now patient was found with by us. So now it has become a passive voice. That is the only grammar again. He was found with or he was assessed with signs A, B, and C. Let me take other sign X, Y, and Z. So whatever signs are given, I said patient was found with these and this problem. Symptoms are here, signs are here. So I will say therefore means on the basis, therefore means on the basis of signs and symptoms, he was diagnosed with again by us. Suppose if question mark is given with the diagnosis, that means he was suspected with. So you write only one thing, either diagnosed with or suspected with. So if question mark is given, then you will say he was suspected with. So whatever disease is given, that again is suspected by us, by the hospital. So only the first line, symptoms, is an active voice because patient comes by himself, complains by himself. But if it is a small child, so patient was presented and his mother complained of. Because small child of 2 years will not complain by himself. So his mother complained. That would be given. You don't have to create anything from yourself. So that would be given. Mother came and she complained of. So the patient was presented and his mother complained of. Otherwise, in active voice, second form. And mother, obviously, he will complain by himself. He complained of. You can also say presented with the chief complaint of A, B, and C. That is also nice. So there is no ratta. You don't have to make it, you don't have to mug it up. That's the only grammar in OET. When it is done by us, he was found with, for which connector, for which he was advised to take rest, and he was prescribed with paracetamol or whatever with medications. Because medications are also given by us, advice is also given by us, was plus third form. Suppose he was encouraged further, he was also encouraged to do exercise. Suppose if you will say, that in after examination, suppose some X-ray was taken. X-ray was taken and he was found with fracture. Means grammar is not changing, ma'am. It only appears to you. That is why people make OET difficult when they talk, sir, a visit letter, sir, this. Make it easy. Suppose you say, sir, this is a visit letter. Now you said on first visit, the patient complained of. Even in the second visit, grammar remains the same. Suppose if it would have been a second visit, I will just change this thing. Rest all will remain the same. Nothing changes in grammar, my dear. Sir, but in discharge letter is different. No, my dear, I'm afraid to say it is not. During hospitalization, the patient complained of. So he will not present. He will complain of because he is hospitalized. So you will not use the word present. But during hospitalization, the patient complained of this thing. Also, along with that, he also had this thing. On examination, he was found. X-ray was taken, and he was nothing changes, my dear. Nothing, nothing, nothing. And if it is a today visit, my dear, if it is today visit, I will copy paste it, will not change it. So suppose if it is today visit, then you have today means present. So the only thing that changes is has complaint becomes has complained. It becomes present perfect. Today the patient has complained of this. Also, he along with that becomes this in the present way. He is having means nothing changes. Was having was converted to along with this. He is also having this thing. The end. And this passive voice was ki jagah has been at every place. I will not even read it. It will all be fine. I will read it in the last. First, I'm changing it. Therefore, he has been suspected. That is today visit. I'm just sending was into has been. Nothing else. Also doesn't look nice here. So also I would like to keep in between. That's the only point. Encouraged. Nothing changes again. That is why OET is the easy. Now this becomes the today visit. Today the patient has complained. It's an active voice. Then you do not put the bean. Bean makes it passive in the present. So you remove the bean, it becomes active. Along with this, he is also now has been plus third form is the passive. That is the only grammar of OET. So it's not about visit letters or anything. This is Dr. Bhupesh from Dr. BKM OET Institutes. Promised you I will take 10 minutes. Sorry, I took around 12 minutes. But that's it for the OET grammar. Thank you.